It's been a wonderful season and we have a lot going on. There are multiple cricketing leagues going on. We know that the war is in the air. But we are a resilient and an extremely brave nation. And the life goes on. In these circumstances, the battle that we are focused for today is going to be between DHQ Aptabad Falcons and PUMS, People's University of Medical and Health Sciences Defenders. So it's going to be Falcons versus Defenders. And I welcome both the teams. So before we move on, I think I have to move on to the introductions. We've got our panel of experts. We have our patron-in-chief, Professor Muhammad Ishaq Saab. Welcome, sir, on the show. Great to have you.
Thank you very much. Thank you, Hamza.
Right, sir. And as we all know, it is the umpire of the game, which is extremely important to maintain the balance. And we have Professor Azizur Rahman Saab, who's going to do the umpiring for today's match. I hope he's there.
I am very much
I
here.
Can't see. Okay, so that's good.
Here.
Very good, sir.
Aziz
I think you have to.
Yes, Assalamualaikum साहब कैसे हैं आप?
आप खैर से हैं? आपकी फ्लाइट कैंसिल होगी गालिबन? Thanks to the war, you are here.
I would have been in Skardu tonight, but unfortunately or fortunately, whatever, the flights are cancelled.
I think it's great for the show to have you. Allah Ta'ala betri kare sir. Bilkul sir, bilkul. And I think we'll be joined by our other panels, members, our faculty members. We'll have Associate Professor Arif Katana Saab, who will be joining us. We have the two mentors and the coaches of the team. So as they join in, we'll have the introductions. So I think before I move on, I will definitely request Professor Ishaq, as you all know, that we had recently lost an icon in medicine. Our icon, Professor Ijaz Vora Saab. We lost him this year, and I will request Professor Ishaq to say a few words.
Thank you very much. I think it's very appropriate to mention about one of our patron-in-chief, Professor Ijaz A. Vora. Vora Saab was a multi-dimensional personality, an institution in himself, very long-standing friend, comrade, active in all medical societies, whether it's Cardiac Society or Aspirin Foundation or Society of Physicians or Hypertension League. He was one of the founders as well. He was a great teacher, great academician, and above all, a great human being. So I think it is my pleasure to present my tributes to him, and I think Professor Azizur Rahman and all of you will join me in praying for his departed soul. May Allah Ta'ala bless him with maghfirat. Allah उनके दर्जात बुलंद करे. बहुत ही अच्छे इंसान थे और आखिरी दिन तक वो busy रहे. He saw patients the day before he died. He was always present in all the conferences, meetings. Wherever we called him, he was there. So we lost a very good friend, guide, teacher, and above all, a very good human being. So God bless his soul. And I think his absence will be felt in all medical conferences. He was always there, and he would make very healthy and very positive comments and very good critical review of the speaker and the presentations. So I think Hamza, everybody has to go one day, but I think he played a very good inning, and he was a great physician, all-round physician with a great interest in cardiology. So Allah Ta'ala unko maghfirat kare.
Ameen, sir. Very right. I think a great academician. I also had the privilege of spending some time with him. What a wonderful person. May Allah Ta'ala bless him with the highest rank in Jannah. So with this, we now move to the game, the match that we have in our hands today. And I'll request the two teams to go ahead with the introductions, and I'll request the captains to introduce their teams. And first, I'm going to start with Aptabad Falcons. Captain, introductions, please.
I am Dr. Zishan Ahmed, third year general medicine resident.
Joining him, I'm Dr. Mustafiz. I'm also third-year resident.
I'm Dr. Fiza, here house officer.
Dr. Noor Bashar, third year resident.
All right, so welcome to the show, welcome to the match, and best of luck to you. With this, I now move to the other team, which is the defenders, Perm's defenders. Can we have the captain, and the captain can introduce the team? Defenders, are you there?
म्यूट किया हुआ है प्लीज अनम्यूट योरसेल्फ
Defenders, you will have to unmute yourselves. Unmute.
Okay.
Technical team.
Hello, assalamu alaikum.
Okay.
वालेकुम
Okay, sound is
Walaikum
okay. Hello.
Yes. Yes, we can hear
Okay.
you.
Okay. Firstly, I want to introduce my coach mentor, Dr. Wasim Raja, which is joining in front, sitting in front of us. Secondly, I want to introduce myself. I am Dr. 𝐏𝐚𝐤𝐬𝐬, working as a resident 4 at PMC unit, Medical Ward 3, along with my team, which includes
Dr. Bari Hassan, resident year 1, internal medicine.
Dr. Masroor, resident third year internal medicine, PUMS.
Dr. Zakir Nawaz, third year postgraduate student internal medicine.
All right. So welcome
Okay.
to the game today. And
Thank you.
best of
Thank you.
luck for the match. So, moving on to the conditions for today. I believe the conditions are overcast. It's been raining. I do expect a little bit of swing. And I think the pitch is going to be a bit inconsistent. Let's see. But I hope and pray that it's going to be a good score from both the teams. Now that we have had the introductions and it's out of the way, let's move to the all-important coin toss. Can we have it on the screen, please?
Yes, sir. It's
Can
on
we
the
have
screen.
the... Yes,
Yes.
let's... All right, now we
Okay.
have it on the
Tell,
screen.
tell.
Very good. So I'm randomly going to ask one of the teams. I had not asked it already. I'll ask randomly one of the teams. All right?
Okay.
Okay. So randomly, I am going to ask Perm's defenders. Well, you wanted to take the toss. All right, let's see. Roll the coin.
Sir, it has come
So,
heads, but no one.
It's a
called
heads.
Who is taking the head or tail?
Okay, I think we'll do it again.
We will do it again.
So I'm going to ask Perm's defenders to call either heads or tails. All right, can you hear me?
Yes, sir.
Okay, so we are going to roll it. What do you want, heads or tails?
Pumps defenders,
Select
please
one,
call.
heads or tails?
Please select head or tail. I guess, sir, they are disconnected. We can ask from Aptabad.
Okay, then
Falcons.
I'll request the other team. Aptabad Falcons, are you there?
Yeah.
hello.
Okay.
Hello.
Okay. So what do you want, heads or tails, defenders?
Tails.
In fact, Falcons are calling. So it's tails. Roll the coin, please. Falcons have called tails.
Yes, sir,
And
it's a tail.
tails it is. Well done.
Wonderful.
So I think Aptabad Falcons are there. They've called tails and they have won the toss. I'm going to pose them with two questions now. The first question is, do you want to take the questions or you want to throw the questions?
Take the question.
They have decided to take the questions. And now the second question. You have two case scenarios in front of you. You want case A or B.
Case A.
And they have selected A. So the news from the center is Aptabad Falcons won the toss. They want to take the questions and they have selected case scenario A. With this, I'm going to request everyone else to keep their mics on mute. The team that is going to ask the question, they should keep it unmuted and then they should mute it. And the team that is going to answer it should unmute, answer the question, and then mute it. And everybody else should be muted as well. All right. So, are we ready for the innings to start.
Yeah.
Counsel, the umpire, sir, should we start? Aziz Saab,
Yes,
should
I
we
think
start?
we should start now.
Okay, very good. So can we have the first case on the screen, please? Perms defenders, you will have to read it out.
Can you please
Read the question scenario.
Zoom it. I can't see it clearly. Zoom it.
Technical team, please help them. Can you see it now?
Quality of the text is so low, we can't read it right. 57-year-old man.
Okay, I think the technical team is on it. We do have some internet issues. I think this was one of the concerns today because of the current situation. But I hope we all figure this out. Can you read it now? Pumps defenders.
Sorry, this is not clear on my screen.
Pumps defenders, you still cannot read it.
We have sent
Okay,
screenshot.
what about
screenshot
Ahmedabad
of
Falcons?
ksA. We have sent
What about
a
Ahmedabad
screenshot of
Falcons?
ksA.
Okay.
ksA to both the teams.
A 57-year-old man presented to you with 4 months of history of episodic headache, generalized fatigue, decreased appetite.
Okay, hold on.
Cannot have-
Ahmedabad Falcons. Hold on. You can read it or you can't read it as well on the screen.
We can't read it, sir. It's not readable on the screen.
Okay, and what about Pumps defenders? Can you see it on the screen?
Okay, my screen is now clear. May I read it?
Okay, read it please.
Okay, scenario case A. A 57-year-old man present to you with 4-month history of episodic headache, generalized fatigue, and decreased appetite. He is known to have a type 2 diabetic patient and taking metformin 500 mg twice daily. He was partially compliant with both diet and treatment. He had no other comorbid or significant past medical or drug history. On examination, he was afebrile with BP of 148/95 millimeter of mercury. Pulse is 88, regular respiratory rate is 24 per minute. Oxygen saturation is 98% at room air, and basal BSR is 265 milligram per deciliter. He was conscious oriented with normal chest, precaudal, and abdominal finding. However, there was mild pedal edema and fundal disease, moderate non-proliferative retinopathy. Lab finding revealed hemoglobin 11.2.
Connected and disconnected.
I think we lost them there. So I'm just going to finish the Vinay. So it says that HP was 11.2, TLC was 7,200, platelets of 2,12,000, HbA1c of 9.8%, urea 112 milligrams per deciliter, creatinine of 1.7 milligrams per deciliter, eGFR of 42 ml per minute, LFT is normal, urine RE showing glucose +3, protein +1 with no blood, casts or pus cells. ABGs were normal. So with this, we complete this first Vinay. So Falcons, are you comfortable with it? Are you ready for the first question?
Yes, we are ready.
All right. So can we have the first question on the screen, please? So I'm going to read it for you. The first question is, he will be classified in which CKD stage on the basis of his eGFR? A, stage 1, B, stage 2, C, stage 3A, D, stage 3B, E is stage 4, and the timer starts now. 60 seconds on your screen. Falcons, you can unmute yourself. We would like to hear the discussion.
नहीं 3B 3B
You want me to
3B
lock it?
click करें. Yeah.
Should I lock
3B.
it? Okay, he says he's sure. He wants me to lock it. It is option D, D delta, right?
Yeah.
Option D delta, stage 3B. Lock it, please. Oh!
ये था 42 नहीं था.
That's a miss. That's a miss. Turns out it whiskered past your outer edge of the bat. An outswinger.
45
Never mind. This
मैंने
was the
पढ़ा
first
था.
one, the first question. With this, we move to the second question. Can we have it on the screen, please?
नहीं वो वाला क्वेश्चन दिखाई ना वो.
चलो दूसरा आ जाओ.
Okay, if you have any issues, I think we have the umpire. We can have a discussion, but we can have it in the end where this can be. Most of the questions you have to bear in mind are reviewed by the board and they are referenced. So if you have any issues, I think the umpire is there and they can have a review on this
We
and they'll
can't
get
see
back to you.
clearly.
We cannot read.
Okay, so they can't see it clearly. Technical team.
Screenshot has been sent to them. They can easily read out from the mobile.
Please read it out from your mobile. You have a screenshot of it.
What is the prepared initial test you will like to order to see the progression?
Okay, so I'm going to read it for you. Which is the preferred initial test you will like to order to see the progression of his disease? Option A, I'll request you to mute yourself or either stay quiet because the question is still going on and I'm reading it, please. Okay, let me finish the question and the options. A is ACR, albumin-creatinine ratio. B is serum electrolyte level. C is serum calcium level. Option D is arterial blood gases. Option E is renal biopsy. Now the timer starts now, 60 seconds.
A.
Now you can answer.
A.
Okay, so you've come down the wicket. You want to hit it for a 6. Are you sure about it? Because Professor
Yeah,
Ishaq
sure.
Saab won't be happy. He wants everyone to take his time.
Yeah, I think I'll
Sure.
reiterate the same thing. They should take their time. They should jump onto the conclusion so quickly. They may be right, but sometimes they can be wrong. And then they'll
Sir,
say,
it's the modern
I wish-
age. They want to play T20, Jayasuriya style. So I'm going to lock option A. Lock A alpha.
Yeah.
Yes. Well done. That's the first right one. So you got this one right. That's a beautiful straight drive for a 6 and you were right. I like the confidence, but you have to put up a good score. Well done. Can we have question number 3 on the screen, please? Can you see it now? Can you see it? Teams, are you there? Can you see it? Aptabad Falcons, are you there?
Yes, we are here, sir.
Okay, can you see
What
the
is the
screen?
first line treatment?
Okay, hold on.
Olena.
I'm reading the question for you. The question is from my side, can you see the screen?
I can't see it clearly. What will be your
Okay.
first? Abhi theek ho
Okay,
gaya.
I'm going to read the question
What
for
will
you.
be your first?
Okay, I'm going
Okay,
to read the question for you. Hold on. I will always read the question. You can see it on your screen and then I'll give you the time to answer. All right? Okay. So question number 3 is, what will be your first line of treatment to control his blood pressure? A, combine ACE inhibitors and ARBs. B, spironolactone. C, loop diuretics. D, beta blockers. Option E, ACE inhibitors or ARBs alone. And your timer
Option
starts
E.
now, 60 seconds. Whoa, you just
ठीक
came
है,
out
E.
and again, Again, you want to hit it for a 6 and you think you've picked it on the full toss. You want me to
Yes,
lock it?
option E.
Okay, as sure as he is, we are going to lock option E, epsilon. Lock it. Oh, yes. Very well done. Well played indeed. Well, it's truly, I think we are playing a Super 5 or something. Well done. Very, very well done. So it's 2 out of 3 at the moment. Great job. So can we have question number 4 on the screen, please? So I'll read the question for you. He was considering metformin the reason for his declining kidney function. You will assure him and advise to continue metformin till his GFR is less than option A, 10 ml per minute per 1.73 meter square. Option B, 20 ml per minute. Option C, 30 ml per minute. Option D, 40 ml per minute. Option E, 50 ml per minute. 60 seconds on your screen.
Yeah.
Let's see what happens.
Option C, 30.
Oh, option C. You want me to lock it again?
Yes.
Again, they are very sure. They're coming down the wicket, and I think they're trying to heave it over extra cover. So I am going to lock option C, Charlie. Lock it, please. And yes, this is 3 in a row. It's a hat trick of 6s. Well done. Very well done indeed. Wonderful. Great, great going. Okay, moving on to question number 4. In fact, number 5 on your screen, please. So I'll read it for you again. To prevent the progression of his disease, you will strictly advise him to control his blood pressure. The 2021 Kidney Disease Improving Global Outcomes, KDIGO practice guidelines on blood pressure management recommend targeting blood pressure below option A, 140 by 85 millimeter of mercury, option B, 130 by 80 millimeter of mercury, option C, 130 by 85 millimeter of mercury, option D, 120 by 80 millimeter of mercury, and option E, 120 by 70 millimeter of mercury. 60 seconds on your screen, please.
ऑप्शंस में देखने दो.
I think B ठीक होगा.
1 मिनट. मुझे A और C में से लगता है.
It's a swinging delivery. Just coming in. Is it going to be whipped for a 6 or it's going to be LBW? 30 seconds left.
A.
Option A, A alpha. You want me to lock A?
Yes.
Okay, so they want me to lock A alpha. Lock it, please. Oh no! Definitely not the answer. Oh goodness, so that's a miss. Again, it hit the pads. A clear LBW, that's for sure.
On 28.
All right, so that's the second miss. Never mind. You still have a few more questions coming your way. We now move to the second half of the questions. Question number 6 on your screen, please. So I'll read it for you. He asked you about the duration of treatment. You will tell him that he will continue this treatment lifelong, but you will discontinue it when you have the following complications. A, dizziness. B, hyperkalemia. C, dry cough. D, angioedema. E, headache. Your timer is on your screen.
B. B, hyperkalemia.
Are you sure about it?
Yes.
Again, he's aiming for a big hit. Coming down the wicket. He's a true Jayasuriya of the game. So which one? Say it again.
B.
B
hyperkalemia.
beta. He wants me to lock B beta. Lock it, please. And he is definitely playing like a Jayasuriya who's in form. Very well done. Very well done. Great job. Great going. So we have a score of 24 on the board. Still 4 more questions to go. So I would like to ask whether we have the defenders online. PERM's defenders, are you there? Usman, do we have defenders, the other team online or not?
Ji sir, we have defenders online with us.
Yes, yes. Defender is online, enjoying the match.
Can you see this?
Very well.
Okay, can you see the screen?
Yes, we can. Yes, yes.
So I'm going to bring the next question. You will read it out. This is the format. All right,
Okay.
I was doing your job for you. Okay. Can we have question number 7 on the screen, please? Read it.
Okay, question number 7. One year later, he present in ER with sub-external chest pain radiating to back, relieved by sitting. His pulse was 110 per minute regular and respiratory rate of 30 per minute. Chest examination revealed nothing significant. On precordial auscultation, friction rub was appreciated. BSR was 310 milligram per deciliter. Serum potassium was 4.9 milligram per deciliter. Urea is 213 milligram per deciliter and creatinine is 2.2 milligram per deciliter. GFR is 28 ml per minute. ABG were normal. Knowing his background history, what bedside investigation can you give further clue to correct the diagnosis? Thank you.
Read the options, please. Options. Options. Please read the options.
Okay. Option number 1 is ECG, B echocardiography, C CKMB, D electrolytes, and E troponin level.
And the timer starts now.
B.
Falcons, unmute yourself. Okay.
B.
What do you want? Are you sure?
Echocardiography.
So that was a bouncer. You're pulling it towards square leg. You think it's going to be a 6. Are you sure about it?
Yes.
You want option B. Okay, as a cardiologist, I love the option. I don't know whether it's true or not. We'll see. So you want me to lock B beta?
Yes.
All right. They want B. Lock B beta. Oh, no. Okay, so we definitely missed it. I think as per evidence, the wrong answer. But never mind. You still can put up a good score as you've got 3 more questions to go. Moving to question number 8 on your screen, please. PERM's defenders, read the question.
Okay. Question number 8. On the basis of diagnosis in question 7, what is the most significant ECG finding on the ECG in this disease? Option number A, tall T wave. Option number B, electrical alternance. C, diffuse ST elevation. D, ST elevation in chest lead. E, broad complex QRS complexes.
Okay, so can we see the ECG, please? Can we see the ECG?
Sir, ECG picture is not included in this quiz, no?
Okay, it's not there, so we don't have the picture. The timer starts now.
Diffuse T wave inversion, ये pericarditis है. मेरे ख्याल में electrical.
All right.
Pericarditis में T wave inversion नहीं होती तो elevations throughout aneurysm में होती हैं.
It's a test of your ECG knowledge regarding the disease.
मैं तो electrical alternance करके आया. सुबह हमने discuss.
25 seconds. Which option? Say it again.
C.
C Charlie. You want me to lock C Charlie diffuse ST elevations, right? You want me to lock it? 9 seconds.
Yes.
Okay, they want C Charlie to be locked. Lock it. Lock the target. Yes. That's a precision strike. Well done. Your drone has hit the target. Very well done. Great job. And this time, another 6. Very well played. Well done. So 30, I think, is a reasonable score. You can still build on it and get to that high scoring range with 2 more questions coming your way. Let's see what happens. Can we have question number 9 on the screen?
May I read?
Read
sir?
it, please.
What is the most specific treatment for a symptom in the disease diagnosed in question number 7? Number A, PCI. Number B, calcium gluconate. Number C, pericardiocentesis. Number D, dialysis. Number E, thrombolytic therapy. Thank you.
And the timer starts now. Thank you. I'm really enjoying this question and the series of questions, in fact.
42 GFR है उसकी वजह से उसमें
Ishaq Saab must be excited too as a cardiologist.
पोटाशियम कितना है? कैल्शियम ग्लूकोनेट.
pericardial
Yes, indeed.
में dialysis 100%. कैल्शियम ग्लूकोनेट तो आप हाइपरकैलेमिया में दोगे.
So it looks like a turning delivery to me. Is it a googly? Is it a flipper? You have 25 seconds. Come on.
पेरिकार्डिटिस में डायलिसिस कर दें.
CKD की वजह से.
D. Option D.
15 seconds. D delta. D delta. Dialysis.
Yes.
Okay, so they want me to lock D delta. Dialysis. Lock it. Oh, yes. Very well done. Very nicely played. That's a terrific stroke. And I think this time he has heaved it for a 6 over the long on boundary. Very well done. Brilliant answering. It's a score of 36. Great going. Falcons, you're flying like falcons at the moment. And you still have one more question, the last question of this innings. Can we have it on the screen, please? Read it, defenders.
2 days later, your junior doctor called to inform you that a specific treatment was not possible and now the patient is having low BP. On examination, he had pulse 120 per minute, at BP 85/60, JVP markedly raised and muffled head sounds. On pericardial auscultation, what investigation would you like to perform now? A option, repeat ECG. B, echocardiography. C, X-ray chest. D, complete renal profile. E, ABGs.
60 seconds on your screen.
ABGs नॉर्मल है और एक्सरे पे आ सकता है. E को B.
Okay. Again, he's come down the wicket. He's crashing it over the covers. You want me to lock it? You want me to lock B?
Yes.
Okay.
Lock it.
They are adamant. As sure as they are, they want me to lock B. Option B, beta, which is echocardiography. Okay. Lock it. And yes. Very well done. Wonderful stroke play. That's definitely over the boundary. And it's a big stroke. So I think you have done very well indeed. You have put up a wonderful score. So we've got a score of 42. That's great going. It's definitely in the range of high scoring games.